Welcome to my final research presentation titled Bad Blood: How Leadership Failures Affected a Nation. For this presentation, we will review my proposed argument, the history of the tainted blood tragedy in Canada, the implications of the tragedy on the Canadian population, where leadership failed these vulnerable persons, and then we will review each sector's specific leadership failures from the non-for-profit, public, and private sectors. We will then review the recommendations made from the public inquiry into the tragedy led by Justice Horace Creever, and finally end with a conclusion. Throughout this presentation, we will review many important facts and events that took place during the tainted blood tragedy, all of which will prove my proposed argument that the negligent actions by leaders in the not-for-profit, private, and public sectors all played a critical role in the deaths of hundreds of Canadians. We will dive into the root cause of this tragedy and find the ultimately fatal missed opportunities by these leaders. The Canadian tainted blood tragedy was a terribly unfortunate series of leadership breakdowns in the 1980s. Canadian citizens in need of blood were unknowingly subjected to two infectious agents through blood donations via the Canadian Red Cross. The Canadian Hemophilia Society stated that the Canadian tainted blood tragedy is one of the worst public health disasters that Canada has ever faced. The two infectious agents were HIV and hepatitis C virus. The Centre for Disease Control, known as and will be referred to as CDC moving forward, describes HIV as a virus spread through certain body fluids that attacks the body's immune system. Over time, HIV can destroy so many cells within the body that they can no longer fight off infections and diseases. When this goes untreated, HIV continues to reduce the number of T cells in the body, and as a result of this, opportunistic infections or cancers take advantage of a very weak immune system, which is a sign that a person has AIDS. The CDC describes hepatitis C virus as a blood-borne virus and causes infection, specifically in the liver. Hepatitis C can be a short-term illness, but for 70 to 85% of the people who become infected, it becomes a lifelong chronic infection. This can result in long-term health problems, even death. Many people might not be aware of their infection because they are not clinically ill. In 1981, the CDC in the US found that HIV was being spread by IV drug users and through blood donations. And in February of 1982, the first case of AIDS was confirmed in Canada. There were two main ways that individuals were infected with these agents. The first way was when a patient received blood transfusions, typically in a hospital, after a major trauma or surgery. The second route of transmission was through blood products used to treat hemophilia, a disorder in which an individual's blood does not clot as it should because there is insufficient blood clotting proteins. Individuals with serious hemophilia depended on blood products, sometimes as often as multiple times a week, to assist with their disorder. Over 1,000 Canadians were infected with HIV through the tainted blood system in Canada. Being infected with HIV and developing AIDS was almost always fatal at the time of this tragedy. Hepatitis C virus was the second infectious agent that was spread through the tainted blood tragedy, where tens of thousands of Canadians were infected with a virus. At the time of infection, the prognosis and consequences of hepatitis C were not known. What is now known is that as many as 90% of people infected could develop chronic hepatitis, and 10% of them will develop cirrhosis of the liver or liver cancer after 10 years, and this number increases to 20% after 20 years. Where were the leadership gaps, and where did leadership fail these blood recipients in Canada? In November of 1985, the Canadian Red Cross began screening blood for HIV antibodies. The test had been available since March of 1985 and was being used in other countries. Understanding this, the CBC investigated and found that between the March and November gap in 1985, where the Red Cross did not adopt the screening tests, 133 cases of HIV transmission via blood products within Canada were confirmed. A screening test for hepatitis C antibodies became available in 1986, although the Red Cross did not implement the screening until 1990. It is very important to note that in 1984, many blood banks implemented surrogate testing, which screened for hepatitis B, a key indicator of HIV. But again, the Red Cross did not. The Red Cross felt that at the time, the $20 million price tag would not be worth the investment, as they felt it would only prevent a small number of cases. Understanding these points give us a clear indication on where the root of this tragedy came from. Without implementing such available screening tests, Canadians were recklessly subjected to and infected with potentially fatal viruses. As a result, there was recognition and need for immediate action. A subcommittee on health issues of the Parliamentary Standing Committee on Health and Welfare, Social Affairs, Seniors, and the Status of Women held hearings in the beginning of November of 1992. The goal of this committee was to review and understand the circumstances surrounding the contamination of blood in the Canadian blood system. After a series of meetings, the committee published a report in May of 1993 that stated the Canadian blood system did not respond to the HIV challenge as quickly as it might have. Throughout the hearings, there was a focus on how leadership agencies involved did not act promptly to understand and mitigate the risks to the Canadian public. Two of the main concerns identified from this committee were why there had not been pre-screen testing created when this hazard and risk was present. And the second failure from leadership was introducing blood products into the system that were contaminated. As a result of this committee investigation, it was noted that the tainted blood tragedy shook public confidence in the health and safety of the leadership within the Canadian blood system. Further to this, it was strongly recommended that leaders on a federal, provincial, and not-for-profit level conduct a comprehensive review of the Canadian blood system by completing a public inquiry. The Commission of Inquiry on the Blood System in Canada, which will be referred to as the Crever Inquiry, was a result of the public inquiry recommendation by the subcommittee and was sanctioned by the Canadian federal government in October of 1993, which was 6 months after the subcommittee's recommendation. This inquiry was led by Justice Horace Crever. The intent of the inquiry was outlined by Crever as to review and report on the mandate, organization, management, operations, financing, and regulation of all activities of the blood system in Canada, including the events surrounding the contamination of the blood system in Canada in the early 1980s. By examining, without limiting, the generality of the inquiry, the organization and effectiveness of past and current systems designed to supply blood and blood products in Canada, the roles, views, and ideas of relevant interest groups, and the structures and experiences of other countries, especially those with comparable federal systems. It took a total of 4 years of investigating the tainted blood tragedy to complete this inquiry. The inquiry issued its final report on November 21, 1997, with over 50 recommendations. Justice Crever reviewed this tragedy in depth in his 375-page inquiry. He dove into this complex disaster with the intent to understand the failures and make them known. The only way our nation could move forward was to unravel these details, as grim and upsetting as they were. Crever made it clear that at the forefront of his inquiry, public trust had been broken, and the only way to fix this was to understand every detail to ensure such devastation is never repeated. The Crever inquiry had an uphill battle when the rights of whether or not they were able to publicly name those who had failed Canadians came into question. As a result of these legal battles, this redefined the role of public inquiries and was able to create a factual framework that has been used ever since. Crever's goal, which he reached, was to break down all leadership failures. The following slides were his findings. To understand the total collapse of leadership within the Tainted Blood tragedy, we will now review the different types of leadership involved and how they failed. The first leadership style to review is the not-for-profit sector. The Canadian Red Cross is a not-for-profit organization which was developed in 1896 as a branch of the British Red Cross Society. The Red Cross was partnered with Connaught Laboratories, part of the School of Hygiene of the University of Toronto. After facing financial hardships in June of 1992, the University of Toronto sold Connaught Laboratories to the Canadian Development Corporation. This corporation had been established by the Canadian federal government with three main goals. As defined by Canada Development Corporation, these goals were to develop and maintain strong Canadian-owned and managed corporations in the private sector, to widen investment opportunities for Canada, and to make profit for its stakeholders. Connaught then became a for-profit corporation. When HIV emerged in the 1980s, it quickly became understood that this agent was bloodborne. Yet the Red Cross was slow to implement screening, and when an HIV test became available, there were delays in implementing it, fearing that this could cause blood donation shortages. The Red Cross did not introduce a test that would have eliminated approximately 90% of hepatitis C virus cases. That lack of a clear policy, Crever found, resulted in a series of disastrous decisions, including importing blood collected from high-risk prison populations in the U.S., delaying the purchase of safer blood products for hemophiliacs out of a desire to use up the potentially contaminated products, and a failure to track down all those who might have been infected. One of these missteps would have been enough to contaminate some of this blood supply within Canada. The totality of all of these missteps in leadership were one of the main factors Crever found to have caused this tragedy. Throughout our readings, we know that historically the not-for-profit sector is known for an undiversified leadership group. We will never know why to their shortcomings and massive leadership failures at this time, but as the sector has evolved and so has leadership, it is hopeful that a more diverse leadership group will have many more voices which would prevent this or such tragedy from occurring again. Dr. Don Francis from the CDC was a key player in the entire Tainted Blood tragedy. Through his research and early work, he was the first person to warn agencies that HIV was transferred through blood. His warnings were ignored by many, including the Canadian Red Cross.
I was shocked at the lack of trouble that they would take to protect the recipients of their blood, because they frankly don't deal with the recipients. They deal with the donors, so their customers are the donors. And their money comes from the donors, and their trouble comes from stirring up resistance in the donors, which is silly, because all they had to do, and we would be happy, we told them from CDC side, to call from donors of women who've had no sex with anybody coming to be a blood donor. We knew thousands would come, And yet they were so reluctant, so stuck in the mud with their system that they had an awful hard time adjusting. And so they continued to not ask the questions appropriately, and some of their most loyal donors were gay men, which is wonderful, but just ask them. If they're gay men, don't donate blood, and they would. They'd stop me here, they're doing good. They're not out there to do harm. And these doofuses in the blood system just carried on. And the thousands of people who died really without any reason are just a negative tribute to their dullness and lack of response that we from the public health expert side had told them what they needed to do. It was pretty straightforward. And for reasons that I still don't understand, we're reluctant to, for a long while, to exclude gay donors. Ultimately, we got the virus and the antibody test, and they get excluded through the antibody test. But at that time, it was really excluded by asking the history that we were asking people by thousands in the public health side about what kind of behavior they did. So we were very comfortable, and so were the sexually transmitted disease clinic, and so would be the blood transfusion people if they had just, I hate to say this, but taken the trouble. I was shocked at
The second type of leadership failure was from the public sector. There were so many public parties involved at one point or another throughout this incident. Some of the key parties from the federal side were the Bureau of Epidemiology, which was a division of the Laboratory Center for Disease Control. Other public parties involved were the regulators, who were Health Canada, the various public health authorities, and of course the provinces and territories. The Canadian Bureau of Epidemiology, a division within the Laboratory Center for Disease Control, began watching for appearances of AIDS soon after the first report was published in the United States in 1981. In March of 1982, the Bureau requested physicians to report confirmed cases and those with symptoms. The Bureau was requesting any information on immunosuppression and associated diseases in homosexuals in Canada. This was to help them understand where the disease was and where it was spreading to. This did not go according to plan, as the forum was not implemented appropriately and provinces did not have their own surveillance program, thus failing to get ahead of this tragedy and addressing these concerns as urgently as was needed. Health Canada describes himself as responsible for helping Canadians maintain and improve their health, to ensure that high-quality health services are accessible, and works to reduce health risks. They did little independent verification of the safety of blood products in Canada. They put 100% trust in the Red Cross, making statements that only 1 in 1 million blood donations were contaminated. Through a CBC investigation, it was found that these numbers were fabricated. Although these infections became known in the early to mid-1980s, it took public leadership until July of 1993 to advise the public formally. At that time, Dr. Richard Chavez, the Chief Medical Officer of Health for Ontario, released a public statement urging anyone who required blood transfusions via major surgery or illness between 1978 to 1985 to request HIV testing from their physician. The provinces who funded the Red Cross for collecting blood and distributing blood products were largely hands-off and indifferent to safety. Similar to Health Canada, little due diligence was done to ensure there was effective safety and blood screening program in place. Throughout these leadership failures, we can see how the idea of new public management which was introduced around the time of this scandal, failed miserably. As reviewed through our course, New Public Management is a concept where the public sector essentially outsources work to private companies to save costs. When these public leaders outsource the blood collection and device manufacturing, this is where a massive collapse and missed opportunities occurred. The third leadership style that is reviewed is private. The three main private agencies that stood out through the Crever inquiry was the various private laboratories in the U.S., Armour Pharmaceuticals, and Continental Pharma Primasam Incorporated. The system in the U.S. with their private laboratories was to pay donors for their blood products, which attracted high-risk populations. Armour Pharmaceuticals in the U.S. produced a product to assist hemophiliacs with clotting their blood, called Factorate. This product was heat-treated to kill the AIDS virus. However, the process was inadequate, contaminating many blood products that infected Canadians. This occurred mainly between July of 1986 and December of 1987. In the early 1980s, U.S. prisons regularly sold blood products to a blood broker in Montreal called Continental Pharma Primasam Incorporated. Continental distributed and sold blood products around the world. This was before a test was created to detect AIDS, and it was understood that at least 72 units of tainted blood collected from 5 Arkansas inmates between 1982 and 1983 were sold to Continental. This lack of initiative to ensure safety for their clients was another factor in the snowball effect of this tainted blood tragedy. There were many lawsuits that resulted from this, although they were not found guilty of any wrongdoings for their part in this historical event. It is evident that during this tragedy, the concept of corporate social responsibility was not an idea that had formed as of yet. The lack of regard for human rights and in a moral and ethic way for greater goods was not shown. We can be hopeful that with the lessons learned from this tragedy within the private sector and the development of corporate responsibility, we will learn from our past and ensure a healthy future with human rights at the forefront. In Crever's final report published in 1997, he made numerous recommendations on how to handle what has happened moving forward. Two of the most impactful changes came through his recommendation on the massive overhaul to all aspects of the blood system within Canada, and the other was offering compensation for victims and families. Those in focus throughout the report and recommendations were the governments, regulators, the blood system operators, and healthcare providers. One of the most significant changes as a result of the inquiry occurred the year following when Canadian Blood Services was established as a new and, most importantly, independent not-for-profit blood authority in Canada, with the exception of Quebec, who created their own. The Canadian Red Cross was no longer responsible for the blood system in Canada. Through Crever's recommendations and implementation of them, Canada began to shift from crisis to confidence in the safety of the blood system. Canadian Blood Services developed policies and programs to address concerns that came from the tainted blood tragedy, and also established committees where donors and recipients could be a part of. Now in 2019, since Canadian Blood Services has been in place, there have been 0 HIV or hepatitis C infections from their product. It's easy to see that Canadians can now be confident that through the gift of blood, they and their loved ones will be healthy as a result. Canada's blood system is now recognized as one of the safest in the world, largely in part to the investigation work of Justice Crever and his inquiry findings and recommendations. The other key recommendation that came from the Crever inquiry was that the victims of the blood scandal receive compensation. Governments were quick to offer compensation to Canadians infected with HIV. Although this process took many years and several legal battles before all infected Canadians received compensation, they eventually did, and individual payouts ranged between $10,000 and $250,000. In total, the payout from governments, the Red Cross, and insurance companies was in the billions of dollars. In conclusion of his inquiry, Justice Craver stated that the slowness in taking appropriate measures to prevent the contamination of the blood supply was in large measure the result of the rejection, or at least the non-acceptance, of an important tenet in the philosophy of public health. Action to reduce risk should not await scientific certainty. When there was reasonable evidence that serious infectious diseases could be transmitted by blood, the principal actors in the blood system in Canada refrained from taking essential preventative measures until causation had been proved with scientific certainty. The result was a national public health disaster. I believe this statement sums up the tainted blood tragedy. The negligence by leadership parties from every sector failed the Canadian population. What is known throughout the various leadership breakdowns is that this tragedy was preventable. Had one of these parties taken charge and put the health and safety of people at the forefront, we may have never reached the height of tragedy that we did. In conclusion, it is evident to see how critical leadership role plays in managing and preventing disaster. To review the opening proposed argument, it is easy to understand that the negligent actions by leaders in the not-for-profit, private, and public sectors all played a role in the deaths of hundreds of Canadians. Throughout our readings, we saw how important governance is and the structure within organization or society. All of this together shapes how participants interact, their roles, and their interactions, which ultimately affect the communication and decision-making process. We can see through this unfortunate part of our history how important governance is in leadership and where we lacked. I work in healthcare myself, and although I was not privy to this tragedy before this assignment, the importance of blood safety and how to treat body fluid exposures is very well known in healthcare. Prior to being able to work at a hospital, you must undergo blood work to ensure you are not HIV, Hep B, or Hep C positive. This is not a discrimination where you are unable to work, but it is so the employer and the staff are aware of potential limitations the individual has in the future, such as closed cavity surgeries for an HIV positive employee, where such is classified as a high-risk procedure for sharps injuries. The culture towards blood contamination in Canada has shifted, and this is the only good thing to come out of such a preventative, devastating tragedy on a national level.